So the handpiece of the OptiVize, it connects with a little cord that comes in the box. So the handpiece comes in a separate small box than the console itself. So make sure you find the right box for this. Take it out, it'll have a little cord wrapped up in the very bottom of it. That connects over to the right-hand side of the OptiVize console. The vaporization contact lens, the VCL, hooks up to the left side. The vibratory expression forceps, VEF, hooks up to the right side. Now let's open up a blister pack. We've got the, we've already used the VCL. Now we're going to use the VEM, vibratory expression module. And we're going to load this onto the VEF, vibratory expression forceps. You see this big shelf sticking out here? That's going to go in that hole right there. So when you start to load this, you want to grip this with your middle finger and your thumb, not your index finger. I've got another job for the index finger. You're going to come in and line this up. Now don't get down too low or too high because it'll bind up on you. You want to come in right exactly flush parallel with that hole there. Push it in a little bit and then get your index finger right down in that gap in front of the paddle, behind the front paddle, right in between them. So it's going to act as a blocking force for this paddle right here. Because if you just push that on straight, many times it'll pop that paddle off on you. And you don't want that paddle inside to pop off of the plunger. So I'm going to line it up there, middle finger and the thumb, put my index finger down inside there. Now the pushing force is middle finger and thumb. This index finger is not going to do any pushing, just these outsides. And then you just give it a little wiggle, a little push, and it snaps on. And I got my paddle still where it's supposed to be. And we're ready to go. Here's your depression plunger that we're going to use to give pressure to the eyelid. And there's a little viewing port right there for getting pictures of what we express out of the gland. And that's a very, very critical step, and it's often missed. Criticals are mandatory because you've got to show the patient what we're getting out of the glands. And it's either going to be sludge, paste, cloudy oil, or hopefully at some point clear oil. The patient wants to see that progress. So they want to know they're getting better, and that's how you show them. So now we've got both paddles. One paddle is going to go down inside the lower lid. I usually start on lowers. I usually start on temporal first and then go to nasal. If I'm going to over here, I do temporal and nasal. And that's just my convention, how I do it every time, so I can keep track of where I am. It doesn't have to be temporal. Then nasal, it doesn't have to be lowers and uppers. You can do that as you see fit in your office. But that's how I do it. When you first pick up your handpiece, there should be a yellow light right up here. If you don't see that yellow light, it means you've got a little switch off right down here on the very base of the inside of the VEF. Let's get that switched on right there. That gets left off lots of times, and then practitioners wonder why the little paddles won't heat up and won't vibrate, because it's just not on. So there's a little hidden switch right there. Get that on. You got to see yellow light before you start. Now you have the patient look up at the ceiling, and I'm going to come in and slip that paddle down right back in that cul-de-sac, kind of like the VCL, right back in there, push down, and then clamp with your thumb right here. You got to clamp to see where you are. So now I see where I am. I like my position. You want to be just barely covering the base of the lashes, or very close to that. So now we're heated up to 39 degrees. I'm clamping, I'm just holding, I'm not expressing yet. But I can already see some oil come out. So we vibrated and heated for 12 seconds. Now it's set expression, so now I'm going to give it a good squeeze. There, we're getting the stuff out. There's the pressure, and go ahead with some pictures. And just like that, we've got pictures of this one. Stop. Okay, I'm going to come out. So again, just to review that, I go in, I get in position, your assistant presses F to activate the forceps, the expression forceps side of the console. Hits F again, second time, to get the heat started. And now you're just going to hold there until you reach 39 degrees. Once it reaches 39 degrees, your assistant presses the plus button over on the VEF side, this side of it, the right-hand side. That starts the vibration. Once you start vibration, 12 seconds will count down. That's your heating and vibration time to melt the solidified meibum. Then it'll say expression. That's the clue to express. Now, there's no time limit on expression. We didn't put a timer on that. You can express for 2 seconds, 5 seconds, whatever you deem necessary, depending on the thickness of the sludge in those patients' glands. All right, so we're going to repeat the process now in the inner half of the right lower lid. So again, I have my patients look up. I use my index finger, pull the lower lid down, give myself a nice deep cul-de-sac, and many times your assistant can go ahead and hit that a little bit early and get that heat going so you're not waiting forever for it to heat up. And now check my position. Good. I'm just covering the base of the lashes. We're heating up to 39. Now we're at 39. He turned on the vibration. I haven't done anything different. I'm just holding. I'm heating and vibrating. And I'm going to give a squeeze and tell my assistant, picture please. There we go. All right, that lower lid is done. Now I don't go right to the upper lid. I treat lowers first because for the upper lid you need to raise the chair. So this way I'll raise it just one time, raise it up one time, and I'll do right and left. But right now I'm going to go ahead and do the left lower. Look up at the ceiling. Now I'm going to do the C technique that I did with the BlephX treatment. I'm going to do that now for exposing the cul-de-sac for my forceps here. So I'm going to use my thumb now, pull down, get right back in there in the cul-de-sac, push down, and then clamp to see where I am. There we go. Right at the base of the lashes is what I want. I'm already seeing a little oil, a little sludge coming out. Now we've reached 39, we've got vibration going. Now I'm going to give it a good squeeze, and I'm going to ask for a picture. He's getting a picture through the lens of the eyelid margin showing what we just expressed out. And like I said earlier, that's very important. Stop. Because you want to watch that oil, that sludge, gradually turn into clear oil. Patients feel really good about this treatment when they see that sludge, that paste, turning into clear oil, which is what we want, right? So you got to have photographic evidence of that. And you take that picture and you make sure it gets onto your medical records. And then we're going to sit down when we're done and we're going to compare last time to this time. Okay, look up high. Now I'm going to do nasal. He's already got the heat on for me. Check your position. Good position. I'm already getting a little oil out.
39 degrees Celsius, vibrator on.
Now we're going to vibrate while we continue to heat.
Expression.
And I'm going to squeeze and watch what comes out. Here it's pretty much just clear oil now. Picture please. Okay, stop. Now taking pictures through this little lens here is a bit of an art form. You got to sort of move opposite the direction you think you need to move because everything gets flipped on you. So just be patient with that. Philip's an expert at it by now, but the first few times it'll be difficult for your picture taker to figure out exactly how close to get, which way to move, the angle of the camera. When Philip comes in, by now it's automatic for him, but the first few times it'll be how close do you need to be. Philip, can you just show that again, kind of how far away you are? If I'm here and I'm expressing, can you just kind of talk about how you position that camera?
Yeah, absolutely. So first of all, I zoom in almost all the way.
The zoom in's important.
And I line it up. And it still won't be focused, so I tap.
Mm-hmm.
It focuses, and then I take the photo.
And how about tilting one way or the other? If you tilt, does that change up or down? So you've got to be careful and have the exact right tilt. You're used to coming in straight on now.
Right.
Yeah.
But, yeah, so sometimes it won't show the full paddle if you are tilted from the side, so you got to kind of look straight at it, and sometimes a little bit down.
Mm-hmm.
I kind of look at the way Dr. Ryerson looks at it and copy that.
So the point is, it'll take a few times to get your picture taker comfortable with coming in and snapping good focus pictures, and focusing is important. Okay, lowers are done. Let's take the chair up. Now let me tell you why we take the chair up. Because when I do lowers, I got the lens right here on my level, and I can look right at it, and I can position and all that. But when I want to go do the patient's upper lids, I got to turn this upside down. And if I go in here like this, and I'm doing upper lids, now I got to bend over. And I got to get my head sometimes down right in their lap almost to be able to see through the lens, because it's now down lower. So I raise the patient up so I can still stand here and see through the lens on my eye level. Typically, it's as high as the chair will let you go. Okay. Now, eyes down.
Heater on.
I'm going to do temporal first. Go in and just clamp right away. Don't try to judge where you are until you clamp your thumb down on the clamping paddle, and then see where you are and decide if you like it or not. And I like it there. I'm right on the base of the lashes.
Vibrator on.
Now, upper lid pictures are just darn near impossible, so I just get lowers. I use the lowers to follow progress. I still express the uppers, and I can see visually. If I see something sort of really unusual, I can finally work around and get a picture. If I'm patient with Philip, stop. But I would just take pictures of the uppers in case you just see suddenly, oh, look at all that goop coming out that you didn't have last time. Anything that's just different, out of the ordinary. Typically, you don't need uppers at all. Okay, eyes down. I'm going to do nasal.
Heater on.
Slip in, take a look. There we go.
39 degrees Celsius.
Hit it again.
Vibrator
There
on.
you go. You want to keep an eye on that eyelid. Sometimes they can migrate on you. When the patient has a lot of edema from chronic inflammation, the edema of the lid margin can kind of cause that lid to migrate up or migrate down. So you always want to watch it. Stop. Okay. And I always want to hit stop. That turns off the vibration before I take this out. If the vibration is still going when you take this out, it just really tickles as it exits the eyelid. So I usually want to stop it when I'm there, then take it out. Okay, turn over a little bit more. Now the upper lid. And then for holding this, the lower is easy, right? Just grab it and got your thumb there. But for the uppers, it's not quite as easy. I get my fingers right down against that piece that protrudes out there, and I can still get my thumb over here. I'm not blocking my lens by getting everything down just as low on this back part as you can. So it's a different grip than if I'm treating like that. So everything down, I can see through my lens, I can still access my thumb switch. Okay, down.
Heater on.
And same thing, I'm going to kind of do the Blefx little technique, rolling again to pop that lid off, get in behind it, and then grip and judge whether I'm in a good position.
39 degrees Celsius. Vibrator
Okay.
on.
Now, if you see any skin below the lashes at all, you're too far away from the lashes. And I'll explain what I mean by that in just a second. Okay, stop. So when I'm looking through there, and I see that my paddle is, let's say, right here, there's a lot of skin between the top of my paddle that's going to be squeezing against the lid and the lashes. What's going to happen is, if all you have in a particular patient is just the little meibomian gland nubs that we see when you have advanced disease, and you're squeezing here, you're not going to get these little nubs up here. So when you place that paddle and you visualize it and you look and see where you are once you grip, make sure you're up like this, way up, almost on top of the base of the lashes. Now you're going to get your nubs that live way up here. So don't be down here. You won't squeeze in anything up here. And every little nub's important. Every little nub's going to have a few little oil acini. They're all important. So we don't want to miss any parts of it. So that's why I say get right up on the base of the lashes for your positioning, not down here. And being up too high, that's probably better than being too low. Too high is okay. You're still going to squeeze the nubs, but then the problem is you'll block your picture on the lowers. You'll block your picture. You won't be able to evaluate what we get out of the glands. Evaluation of those esterified oil contents is an important part of this treatment. You want to be able to see what it looks like, see your patient's progress, and know when you can go from monthly treatments of these REVVE treatments to every 6 weeks. That happens when they first get clear oil. No more sludge. They get to go 6 weeks to the next one. The next time point is 8 weeks. So if the 6-week treatment is still clear, you can go to 8 weeks. If that's still clear, you can go to 3 months and so on till you get out to every 6 months for maintenance. So that's the other reason it's important to take pictures and see that stuff when you express it. So then you can talk to the patient about it. You know, you can say, well, we got sludge back again. We need to tighten it back up to 4, or we need to do another 4 because you had sludge like last time. Or, hey, we got clear oil. We can now go out to 6 weeks. So that's why you've got to see it. Last one, eyes down.
Heater on.
I usually pop that out a little bit. I use the corner. I come in kind of an angle. I get the corner up under there. Then I rotate in. I slide over and look for my position and adjust it as you need to. Look way down from me. Way down. Okay.
Expression.
Big squeeze. Okay, and stop. All right, a couple little things to keep in mind. A lot of these patients have had really chronic disease for a long time. A lot of tissue destruction, especially if they're producing cytolytic toxins. You can have foreshortening of the inferior fornices and not be able to get down in there very well. And you'll be up on top of the lashes and look through there and not even see any lid because you can't get down deep enough because of scar tissue. So that can happen. You just do the best you can. Sometimes when you're putting that in and you can't get down far enough, what I do is I go as deep as I can, then I'll grab the lid out here on the side and I'll try to stretch it up and then go down again, stretch it up, go down again, and kind of walk your way down. Sometimes you can get it where you can see the eyelid margin. Okay, we're all done. I turn my light off on my handpiece. Now, before your next patient, when your next patient comes in, you're going to need to change out the expression forceps just like you'll put a new VCL on. So to take off this expression forceps, there's some little tabs right here on the side. You just get a thumbnail under one of them and just pop it out. It'll gap a little bit. Then you go under the one on the other side. You can hold your finger there to stabilize that so it doesn't just fall on the floor. Give a little pressure there. Take that one out. Now it's ready to pull off, and then you just work it out. It comes off. And then toss it. And that one's done. So we've got pictures now. We've got today's pictures on the little iPhone. We've got last month's pictures on the iPad. Pretty good tear lake last time. A little bit of sludge there. How's it look today? All right, sludge is gone here. And we still have really a nice tear lake. And that's mostly clear oil there now. So that's progress. Then let's look at the left eye towards the temple, temporal OS lower lid. No sludge. Last time the sludge was all over the place. It's totally gone now. Sludge is gone, and now it's just clear oil.
Yay!
That means they're making nice progress. See why it's so important to take these pictures, right? Your patients don't want to come in and spend all kinds of money and not be able to see that we're getting improvement because sometimes they don't feel improvement right away. Sometimes it takes a while. It takes a number of treatments before you start feeling the improvement. So this way your patients, after a few times your patients, they learn what to look for. You're educating them. And they'll look at it and they'll say, oh, well, hey, my sludge is worse today or my sludge is better today. Sometimes you don't say anything, just show them the pictures. And they get it. They're educated, just like they're educated about this disease when they watch the patient education video before they come in. Make sure your patients all watch that video. It's an important part of getting treated for disease is understanding the disease.